KEYNOTE-040 was a phase 3 international randomized study that assessed the role of pembrolizumab, an anti-PD-1 antibody, in recurrent metastatic squamous cell carcinoma of the head and neck, but specifically in patients who were platinum refractory. So in other words, these are patients who would have been treated initially with curative intent, unfortunately developed recurrent or metastatic disease, had platinum at some point in their course of disease, either during curative intent therapy or as treatment for recurrent metastatic disease, progressed on that, and then were eligible to enroll in a randomized trial on either pembrolizumab versus one of 3 standard of care options. Those standard of care options included methotrexate, docetaxel, and cetuximab. The trial was conducted around the world, and what we found was in fact that pembrolizumab delivered a clinically meaningful benefit versus standard of care in these patients. The hazard ratio was 0.8, a p-value of 0.016, and what that really translates into is a 1-year survival with pembrolizumab of about 35%, so a little bit more than a third of patients were alive at 1 year, as opposed to standard of care where under a quarter of patients, so about 24%, were alive at 1 year. And really, unprecedented results for immunotherapy in this disease, in that prior to the anti-PD-1 inhibitors, other studies in recurrent metastatic patients who were refractory to platinum had all been negative. And so very exciting data. The other things to note about the data set were first that the response rate was higher in patients receiving pembrolizumab versus standard of care. And perhaps this applies when we're thinking about which patients best to treat, the higher the PD-L1 expression in the tumor, the greater the benefit. And this was especially exaggerated in patients whose tumors expressed very high levels of PD-L1, the so-called TPS greater than or equal to 50%, where now we see that a quarter of patients responded, 25% response rate, which is very high in this setting, and almost half the patients were alive at 1 year. Truly unprecedented data in recurrent metastatic head and neck cancer. More recently, we've now seen some of the quality of life data on KEYNOTE-040, and in fact, at the American Society of Clinical Oncology in 2018, Kevin Harrington and colleagues presented those quality of life data. And across the board, what we saw was an improvement in quality of life for pembrolizumab versus standard of care. And perhaps most importantly in this patient population, the key elements of quality of life, pain, speech, swallowing, were all better on the pembrolizumab arm versus standard of care. So now when we look at the totality of the data, we can state quite reasonably that pembrolizumab improves survival, improves response rate, and improves quality of life compared to standard of care in patients with platinum refractory, recurrent or metastatic squamous cell carcinoma of the head and neck. Very exciting data and a very important step forward in the treatment of these patients.